Today on the Transplant Helper, I want to discuss the subject with you, what to do when you feel bad. You know as well as I do, you're going to have ups and downs, good days and bad days, but what do you do when those times arise? That's what we're talking about today, so stay tuned. Hey folks, welcome to Transplant Helper today. My name is Jim Merle. Today we're discussing the topic, what do you do when you feel bad? Now, I've kind of discussed this in time past on the program that I'll try to link to here, but basically what I talked about then was the fact that we're going to have good days and bad days, ups and downs, which is true, and basically how to handle that emotionally. And the main way to handle that emotionally is just by knowing bad days are going to come, not getting too frustrated or discouraged, and be looking forward to the good day on the other side. That's what we do emotionally or mentally. But what do we do physically? What should our actions be if we find ourselves not feeling right, feeling ill, feeling crummy, being under the weather, or being downright sick? What should we do about that? What should our actions be when that may arise, and probably will at some point in our lives? That's what we're talking about. But before we get into our main points, I want to say in the beginning, if you're not feeling well, if there's something going on in your body that you're concerned about, you need to call your transplant team. First and foremost, and above everything else, pick up the phone, call your transplant team, get in touch with your coordinator, your doctor, whoever's going to answer that phone, and let them know something's going on, because they cannot help you if they do not know there's a problem. That's obvious, but I think some of us hard-headed transplant patients need to be reminded of that. Now, with that said, I want to mention to you 3 different things today that I think we really ought to keep in mind as we're preparing to make those phone calls or preparing to go into clinic or wherever it is that doctor might deem that we need to be checked out. So here's what they are. Number 1, before calling your doctor or especially going into clinic, document. That is, document. What I mean by that is be willing to triage yourself. You all know that part of the clinic visit or the doctor visit, emergency room, whatever, when you go in, they take you off in a little side room, a nurse does, and they begin to ask you a series of questions, and they usually do basically the same things. That is, they take your temperature, they weigh you, they take your heart rate and your blood pressure, and that happens almost without question every single time. Believe it or not, those vital signs, that triage, is a really big deal. You know what it is to have a fever. To have a fever may imply that there's some kind of infection, so you need to take care of that. So if you've got a fever over 100.4, I think is kind of the threshold, they then consider that a fever. I know I feel terrible at 99.1, but 100.4 is considered a fever. So if you got anything above that, that's one good reason for calling your transplant team or going in to see them, because that's important. At the same time, say you take your blood pressure, not once, but a few different times, and you notice that it's 10, 20 points higher or lower on either one of those numbers, that's a call, or if you will, a need for calling or going into your transplant center. They need to know that. And with your weight, if your weight goes up and down 3 to 5 pounds in 24 to 48 hours, big deal, because they need to know that. That could be a sign of fluid retention or whatever, and just things that they need to know. Heart rate, that's very simple to understand, especially for us heart transplant patients. You know, we're sensitive to what our hearts are doing, whether they're fluttering or racing or skipping beats or pounding. You know, we know that, but we need to document that. We need to let them know so that when we go into clinic, we can, number 1, give them good information that they can use to help them diagnose us and make a decision on what to do. But at the same time, maybe we need to prove our case. If you've been where I am a couple of times in life, you've just over the course of a day or two felt awful. I can remember one time my fever was 103.6. I was coughing my head off, felt terrible, stuffed up, all these different things going on. I go to the clinic, it's like a miracle happened between my car door and the front door of the clinic. I get in there, no fever, no cough, feel just fine. But it's better to go ahead and say, you know what, I still felt bad last night, or I still felt bad yesterday or the day before. And if you got those things documented, here's what my fever was, here's what all these vitals were, triaged over time, you can prove your case. So number one, document. Number two, describe. And what I mean by that is once you get into clinic, be descriptive. Be honest with them. Tell them everything that's going on. Try not to leave anything out. And then just be descriptive. Whatever you're feeling, communicate that the best way you can. Even if you feel silly or goofy or whatever you want to call it, go ahead and communicate with them by describing your symptoms. I know many times lately I've told my doctor that I'm having what I call a backside heart attack. And what I mean by that is it's right here, right below this right shoulder blade here. I have this awful pain. Feels like a heart attack, but on the backside. It's not chest pain here. It's not up and down my neck. It's not down my arm. My arm's not tingling. None of the typical symptoms, but it's in the back. And I've come to know this probably some of those nerves growing back we talked about in the last program I linked to here about can you feel your heartbeat after transplant, but nonetheless it hurts. And so I tell them, and I describe it the only way I can, it's my backside heart attack. Just do that. Just like the old people, even ourselves, we made fun of in the past. You go into the mechanic says, what's wrong with your car? And you say, well, it's going chugga chugga. Hey, describe your body that way if you have to. Let them know what's going on. Be completely open and honest as you do that. So that's important. Now, next, not only document and describe, but be determined. And I mean by that, be determined that whatever the doctor decides the plan of attack is to be on whatever's going on with you, be determined you're going to do it. Again, don't be like me in the past. Go into clinic with all these complaints, all these problems that are going on, and when the doctor says, Jim, I think we need to admit you and do a few tests, or we need to hold you for a few days for observation, start backpedaling and say, oh no, I don't want to do that. I didn't come over here to be admitted. Yes, you did. You came over here to get treatment, and if they deem that the best treatment you can get right now is to be admitted, just be determined you're going to be in compliance. You're going to agree, and you're going to go along with it. And at least until something else comes up, you're going to do what they ask you to do. Now, in my mind, these are three things we need to do every time we feel bad, and that is document, triage yourself, describe, be willing to be honest with the doctors, and be determined whatever they tell you, go ahead and just do it. Do what they ask, and I promise you, you'll live a better life. Do doctors make mistakes? Yeah, at times. But I promise you, they've been trained longer, they know more, they're more professional, experts, whatever in their fields, more than I am or you, so just go ahead and be compliant and in agreement with what they want you to do. Now, if this program has helped you in any way, how about go ahead and like, subscribe, and share this program out and help out the rest of the world, maybe in some small way, like I hope that this has helped you. And if it has, thank you so much for watching. I'd love to hear your comments in the show, in the comment section below as to what your situation is. What do you do when you feel bad? I like to know about it. We can share and continue to build this community. Okay? So until next time, stay stronger, friends. Hey, wait a minute. I saw you. You've been staring at this t-shirt the whole time I was talking. You can't get it off your mind. So if you'd like a t-shirt just like this, hit the link in the description below, and I'll be more than happy to hook you up.